Good morning. Welcome to the third webinar in our Access for All guest speaker series as we get closer to expanding CalFresh eligibility to SSI recipients starting on June 1st. My name is Brian Kaiser, and I'm the Chief of the CalFresh and Nutrition Programs Bureau here at CDSS, as well as your host for today's webinar. This program expansion marks an historic moment for California and will significantly increase the number of Californians eligible for CalFresh food assistance. As we prepare for this change, this is a great opportunity to spend some time thinking about how we can truly make CalFresh food benefits accessible for all and develop a better understanding of what it means to serve a diversity of clients. The intent of this webinar series is to provide a platform for a range of guest speakers to address the topic of making CalFresh accessible to all. Today's webinar presentation is about serving older adults. We hope that you'll get at least one nugget of new information, a new perspective, or a new way of thinking about how you can most effectively do your work each day. We then hope that you incorporate these lessons learned into your practice as we race toward the June 1st, 2019 implementation. We are joined today by several terrific guest speakers from the National Council on Aging, Mexican American Opportunity Foundation, CSU Chico's Center for Healthy Communities, and the Watts Labor Community Action Committee. I will introduce them in just a few minutes. But first, let's go over some webinar logistics and give everyone a quick refresher on the policy change that brought us all together for this webinar series. Today's webinar will be in listen-only mode, which means you can hear us either through your telephone or through your computer, but note that all lines will be muted during the presentation. We are happy to be offering live closed captioning for people with hearing challenges by clicking the link shown on your screen, and we will upload closed caption versions of each webinar to our webpage at cdss.ca.gov/CalFreshSSI, or just Google CalFresh SSI and it's probably the first thing you'll see. This brings me to the next logistical detail. How do you ask questions? You can ask questions by using the question panes feature on the right side of your screen. For today's presentation, we won't be answering questions live, but you can submit questions at any time during the presentation, and responses will be provided back to all recipients after the webinar. Responses will also be posted on our website, along with all the materials and a recording of today's presentation. Next slide. Next, I'd like to do a quick plug for the upcoming webinars in our Access for All guest speaker series. There are two left in the series, both happening on April 16th. Serving people in multiple languages and welcoming immigrants is in the morning at 10 a.m. on the 16th, and serving diverse communities and advancing racial equity is in the afternoon on the 16th at 1 p.m. If you haven't done so already, you can register for these on our website. And if you missed any of our previous webinars or want to download copies of the materials, please visit our website shown on screen at cdss.ca.gov/info-resources/CalFreshSSI/training. Next slide. Before I turn it over to our guest speakers, let's provide everyone with a quick review of the upcoming policy change that will expand CalFresh eligibility to SSI recipients. California's cash-out policy started in 1974 when the federal government began the combined federal and state SSI-SSP program. At the time, states were allowed to increase the SSP portion of the grant instead of administering what was then known as the food stamp program. California opted for this cash-out policy, as it's known, and increased the monthly SSP grant by $10. Back then, in 1974, this change made sense, as that $10 was roughly equivalent to the average food benefit at the time, and it was an efficient way to provide food benefits to an eligible population. Under the cash-out policy, SSI recipients have since been ineligible for CalFresh food benefits because, in theory, they were already receiving the value of CalFresh benefits within their SSP grant. The challenge, of course, is that over time, the value of CalFresh benefits has increased roughly with the rate of inflation, while SSI cash-in amount has remained flat at $10 and has lost relative value. This means that many SSI recipients who are living on a very limited budget intended to cover all basic needs are likely to have unmet basic food needs, and they are unable to apply for CalFresh food assistance for help. Last summer, Assembly Bill 1811 passed as part of the state budget, which ended the policy that we know as cash out and put the wheels in motion to allow people in California who are who are receiving SSI and SSP to apply for CalFresh food benefits on or after June 1st, 2019. It's important to remember that there will be no change to the combined SSI-SSP benefit as a result of this policy change. This simply provides an opportunity for affected households to increase their total budget with monthly food assistance. And with that, I have the pleasure of introducing our guest speakers for today. Erin McGovern is with the National Council on Aging and will be starting us off today. Mayra Gutierrez is from the Mexican American Opportunity Foundation. Malai Vu joins us from Cal State Chico's Center for Healthy Communities. And Phyllis Willis joins us from the Watts Labor Community Action Committee. Welcome to each of you, and thank you for sharing with us today. Erin, I'll hand it over to you now.
Hi, thank you. Next slide, please. So I am Erin McGovern, and I am Associate Director of Economic Security at the National Council on Aging. The National Council on Aging is the national voice for every American's right to age well, and our vision is a just and caring society in which each of us, as we age, lives with dignity, purpose, and security. Next slide, please. Our mission is to improve the lives of millions of older adults, especially those who are struggling, and our social impact goal is to improve the health and economic security of 10 million older adults by 2020. I'm happy to say that the National Council on Aging has actually reached our goal early, and we will be announcing at our conference this summer our plans for the future as we move towards 2020 and beyond. One way that we've impacted the lives of these millions of older adults is through our Center for Benefits Access. NCOA's Center for Benefits Access provides benefits outreach and enrollment assistance to older adults 65 and plus, and also younger adults who have disabilities. One way that we help older adults improve their economic security is by enrolling them in valuable benefits such as SNAP. So today I'm going to talk to you about some best practices that we've learned from our nationwide partners who have been focused on this work since 2009. And then some of our current grantees who are located in California are going to talk to you about their experiences enrolling older adults in benefits and best practices that they've learned along the way. Next slide, please. So about 2 years ago, NCOA did a nationwide survey to determine why older adults were not participating in benefits that they were eligible to receive. And we found out that there were 4 key reasons that older adults were not participating in these programs. The first was lack of awareness of programs. Older adults did not know that they were eligible for benefits. In particular, older adults are not aware of their eligibility for SNAP. So one thing that we identified was increasing awareness of programs. Another barrier is assuming the application process is tedious. And this is especially true for the SNAP application process in many states. The application can be long, in some cases up to 40 pages, so it makes it very difficult for older adults to apply because it is time-consuming and complicated. Oftentimes, older adults also did not know where to begin to apply. So if they had heard about SNAP or they knew someone who might be in their community already enrolled in the program, they might not know where to go to get information about how to apply or where to start their application. Finally, we heard from older adults that they thought other people needed help more. So in particular, with the SNAP benefit, older adults commonly told us that they thought SNAP was only for families that had children, or it was only for households that were different than their household. Or they felt like they had been making ends meet for as long as they've been financially independent, and so they felt like they didn't need SNAP, and someone else who had a more difficult financial situation would benefit for it more. However, since SNAP is an entitlement program, it grows to meet the needs of all those who are eligible for it. Next slide. So we have identified some promising outreach strategies. And these address the first barrier that I mentioned, which is many people not knowing about the program or not knowing where to apply. So the first strategy we have is using multilingual radio, television, and newspaper outreach. We learned from our study that traditional news outlets such as television and radio and the newspapers are still where most older adults get their information. So these are radio programs that they're listening to every day, they're reading their newspaper every day, and they're watching television. So if you want to do an outreach strategy or outreach campaign, this can be very successful. We also found that there are many strategies to pay for this multilingual outreach, including partnering with companies who might be providing food services or food products targeted to older adults and would be willing to supplement the cost of the outreach while they're also promoting their project or their product. We also found that using social media and targeted online advertising has been very successful. And this includes Google ads and also Facebook strategies. NCOA has done large pushes around ads on Facebook that are targeted to older adults who are searching for things such as help paying for groceries, help stretching my monthly food budget, eating healthy on a budget. And you can target advertisements around those key search terms so that older adults who are looking for help or who are looking for more money can be connected with your organization that can help them apply for SNAP. We also found that integrating SNAP or CalFresh outreach with other benefit programs was very valuable. So for example, if you're doing outreach around LIHEAP energy assistance or Medicare, something that older adults might be a little bit more familiar with, those people are most likely also eligible for CalFresh. And so when you're helping with one benefits application, you can help with the CalFresh application as well. We also found very successful with building partnerships within community to increase the scope of outreach. So your organization might only be targeting outreach to a specific group of seniors who are familiar with your organization. But if you partner with your local food bank or your local senior center, you might be able to reach more seniors who have not heard of your organization yet. Next slide. So once you've done outreach, how do you educate seniors about the value? The first thing we said was reframing the CalFresh food benefit to demonstrate its value. And so many of our partners have done this by educating older adults about the benefits they might receive. There's a lot of misconception that you're only going to receive $15 a month, and that's the minimum benefit amount, but we've actually found that on average, older adults receive over $100 a month in benefits. The other way to do that is to actually show what the value of the benefit is. So many of our partners will prepare a grocery basket or a food basket that has the average monthly benefit amount worth of food in the basket. So you can see just how much you can purchase if you get 1 month of benefits. And that really drives home the value of enrolling in this program. We also recommend doing education to reduce the shame and stigma around the program. Many older adults might feel uncomfortable asking for help because, as I mentioned before, they felt like they've been able to make their ends meet for most of their life, and they feel uncomfortable asking for help now. But one way we do this is by letting them know how many people are already benefiting from the program and that it is something that they are eligible for and that they have paid into this program much in the same way as they pay into taxes, because it's something that's available for everyone who's eligible to participate. We also recommend building trust with the participants to ease their anxieties. So establishing relationships with your clients who are coming to talk to you. And this means that you may not help someone complete their application on your first communication. You might have an initial conversation where you're just getting to know them. learning about who they are, what their needs are, why they're coming to you asking for help, what life changes have happened. And then on the second or third visit, once you've gotten to know them, you understand their situation, they feel comfortable talking to you, that's going to be when you're going to get to that chance of helping them complete the application. We found from most of our partners that usually 3 to 4 touches with a client are what it takes to get them comfortable with applying for the application and building that trust. Next slide. And finally, we have promising application and enrollment strategies. The most important thing I recommend doing is providing one-on-one application assistance, and if so, doing this in person. One-on-one assistance means that you have a private space to talk to someone where they can feel comfortable asking you any questions that they have. And doing this in person is very important because it allows you to read body language, to tell how comfortable someone is, to make eye contact, and to build that trust that I mentioned previously. Also taking advantage of contact that you've already had with enrolled seniors to focus on their eligibility. So this means that if seniors are already enrolled in other programs that you've helped them apply for and you've built that trust, you can focus on their SNAP eligibility now, or CalFresh, because they've already had experience with you enrolling in benefits and they know a little bit more about what that process is going to be like. So you can reach back out to them and tell them, you know what, I helped you apply for LIHEAP last year, but it looks like this year you're also going to be eligible for CalFresh now. Why don't you come back in and we can help you apply for your CalFresh application? And finally, working within your organization to provide better screening and referrals. And what this looks like is no wrong door policy. Every person who's coming into your organization is going to receive the same information about CalFresh. They're going to be screened at intake for food insecurity and screened for benefits eligibility. And then you can make a referral internally to the correct person to help them with the application. But you're not putting that burden on the senior to find the person within your organization who can help them. You're doing that internally as staff. And finally, just providing training to your staff on how to be sensitive and talking to seniors who are potentially eligible but not participating in a way that makes them feel comfortable. Next slide. Okay, we are now going to hear from Myra at Mexican American Opportunity Foundation.
Thank you, Erin. Good morning, everyone. My name is Myra Gutierrez, and I'm with the Mexican American Opportunity Foundation. MAOF, as we are known, is a nonprofit community-based organization that has been serving disadvantaged individuals and families in the Los Angeles area for more than 50 years. MAOF is the largest Latino-oriented family services organization in the U.S. However, we welcome non-Latinos and we provide services to all. So today I'll be speaking on the best practices when working with Latino older adults. However, I believe that this would apply to any older adult. Next slide. So we'll start off with gaining trust. So gaining trust is the best practice when working with Latino older adults. Gaining trust is paramount to get them to listen to you and open up to you. If they don't trust you, they are not going to be receptive to anything you have to tell them. So again, gaining trust is paramount. And part of gaining trust requires that you build a safe space for them, somewhere where they could come and, just talk to you about anything that's on their mind. They have questions for you, a place where they feel like they can ask questions without feeling, either embarrassed or afraid. And speaking their language, obviously, most of our clients are monolingual Spanish speakers. So when they come here, they can speak to us in Spanish without embarrassment or fear. And most of them are, have very minimal education. So you also have to be able to speak to them at a level that they'd understand. So once trust is built, then they will spread the word about your agency. So, trust is very important. So we'll move on. Next slide. So another best practice is go where they gather. You can't just wait for seniors to come to you. You have to go to them. And once going back to trust, when trust is built, then they will come to you. But you do have to go out and be visible in the community. So you have to go to senior centers, senior buildings, churches, local social security offices, and hospitals. Next slide. Okay, and another best practice is being prepared. So you have to educate yourself about a benefit program. And we're speaking today about CalFresh, but I think in general about any benefit program before you attempt to educate senior clients about it. You have to have materials in the language that your clients speak, and your materials should be concise so that you don't overwhelm your clients with a lot of information, a lot of technical language. And you should be prepared to be ready to answer questions and to speak to family members. Oftentimes, you talk to a senior about CalFresh, and then they're like, I want to talk to my son about it or my daughter. So again, you have to be ready to speak to family members. Next slide. It's also very important to tailor your message to the senior community. And as Erin had mentioned, you must address myths and or concerns seniors have about CalFresh. Some of the myths that we've encountered are they will have to pay the state back for participating in CalFresh. They will reduce their Social Security benefit if they participate. CalFresh is a public charge program. If they participate, they will take the benefit away from families with children, and that they will only receive $15 in benefit. As Erin mentioned, the average is about $100, but these are a lot of myths that seniors haven't or they've encountered, and so if no one's ever challenged it, they believe it. So you have to be able to sort of explain to them, okay, these are the facts, and this is actually just a myth. And next slide. So lastly, a best practice when working with, again, Latino older adults or just any older adults. To be successful, you have to build partnerships, and so that's vital for outreach. Partners help you in spreading your outreach message. They are important also in building trust. If a senior already goes to a senior center that they feel comfortable in, that they trust going there, and you go there and you're welcomed by the director there, then if they trust the director, then they will trust you as well. Partners help with referrals, and partnerships allow you to be more visible in your community, which again we'll go back to trust is very important in gaining trust. And lastly, when building a partnership, it's important to have a key contact person. And that'll be it for me. So I'll now pass it over to Malai Vu from CSU Chico Center for Healthy Communities. Thank you.
Thank you, Myra. Good morning, everyone. My name is Malai Vu, and I'm with the CSU Chico Center for Healthy Communities. Our center is a bit unique. We have a grant from the California Department of Social Services to provide CalFresh outreach statewide. And we also have a grant from the National Council on Aging to connect older adults and those with disabilities in the far north to benefit programs, and CalFresh being one of those core benefits. We are closely connected to Chico State, so the majority of our direct services, such as outreach, application assistance, and follow-ups are done by our program assistants and student interns and staff. This is our third year as a BEC, or Benefits Enrollment Center, and we'd just like to share some of our best practices. Next slide, please. All right, so some of our best practices that we at CHC would like to highlight include outreach, application assistance, county partnership, and tips for follow-up. Next slide. Okay, so for outreach events, we like to, they're usually led by a program assistant or student staff or a returning student intern lead. We like to attend community events that draw the most people. Food distributions being one of those larger events. We have learned that we need to get to these distribution sites early, as people usually, show up early to wait in line for their food. We have found that once they get their food, we tend to miss them. And so while they're waiting in line, we like to pre-screen them. And if they're interested in applying, we can do an application while they're waiting in line. If they don't want to complete the application while they're waiting in line, we also take down the information and we can do a follow-up and help them with an application later. We submit all CalFresh applications online. We use tablets and laptops when we go out into the community to provide outreach. We also have a mobile hotspot in case there's no internet or Wi-Fi available. So in the far north, transportation and access can be challenging. Most of our older adults that we serve do not have an email address or access to internet. And so we have had good success reaching older adults when we go to where they specifically live when we're providing any application assistance or outreach. And so we provide outreach to residents in low-income or subsidized housing complexes. The resident managers really help us promote and provide a space for us to assist with applications. So such as, letting us hang up flyers or using their community rooms. And the residents, they tend to have a really great relationship with their resident managers. And so resident managers are also really excited to help their residents. And so when we're providing an on-site assistance, what we do is we have a sign-up sheet. This helps us manage the flow more efficiently. Residents find it helpful because they'll know when it is their turn. It also helps, eliminate any uncertainty regarding who is next. And it also helps us gauge how long a resident may have to wait. All right, next slide, please. Okay, so when we are at an outreach event or when someone walks into our office needing application assistance, there is an in-house process we follow. So whenever we're assisting an older adult or someone with a disability, we always collect their contact information and we have them sign a release of information. We collect their contact information for reporting and follow-up purposes. The contact sheet really helps us answer some of the application questions already. So this way, we're not asking the client the same thing multiple times. We have applicants sign a release of information. This form helps us communicate with the county on the applicant's behalf should any questions come up during a follow-up. It's also a state form and it is accepted in all counties. We are currently using the getcalfresh.org website to sign people up for CalFresh. We have found that Get CalFresh is easier to use, and we can usually get through an application within 10 minutes. We have a community-based organization account, so ACBO account, which helps us with reporting, and we're also able to see some data. So if you would like an account, you can go on the website, and there are directions on there. And I do believe Get CalFresh will be live in all counties beginning June 1st. All of our new staff and interns use the demo site to practice an application. So at demo.getcalfresh.org, you can practice an application. Depending on our household situation, it asks different questions. So for an older adult, you have to answer questions that are relevant to their situation. If there's a medical expense screen, and in there, it's usually for a household with an older adult or someone with a disability. The link to the demo is on the screen, as you can see. So this is what we use to train new staff and interns. With a demo, you can go through the whole application and submit it, but the application isn't going to the county. It's just a practice. It takes you all the way through it. When we're assisting a client with an application, we always do the application for the client. So we ask the questions, we type in the answers. It definitely makes the process a lot quicker because we're familiar with the questions and we can explain them. So after we submit an online application, we go over an in-house form called Getting and Keeping CalFresh Can Be Easy with the applicant. And it is a tool that was created by our team to help the applicant visually see what comes next. So next slide, please. All right, so we have this visual that is kept at our front desk. After we assist someone, we always refer to this tool as a guide for our applicants. So, today we've helped them submit their application. Next, they will need to do an interview, and then after that, they will have to submit verifications. So we explain to the client or the applicant that the application was submitted, and they should expect an appointment within the next 2 weeks if they're not eligible for expedited services. If they are eligible for expedited services, they may be getting a call from the county within the next 3 days. And then we remind the applicant that the county may call from a blocked or private number and that they should pick up their phone within the next couple of weeks. We also prepare the client and let them know that interviews usually take about 20 to 30 minutes depending on the household, and that interviews
I don't know.
Hi, everybody. Please bear with us as we try to figure out what happened with Malai. Please stand by.
All right, sorry about that. I think I was cut off. So just going back to this document. So this is what we use. We remind them, if they submitted the application today, they'll get an interview, and then they have to submit verifications. We let them know that the interview is for the county to verify and clarify information about the household. We also remind the applicants that the county will ask them similar questions to what we've already asked them, but that they may ask additional questions as well. We want them really prepared. After the interview, verifications are needed, and so we let them know this as well. And we do offer, we do let them know that they can come back to us with any documents from the county. We can help them, sort through it and help them send in the proper verifications. Next slide, please. Can we go to the next slide? Okay, perfect. All right, so for county partnerships, county partnerships are really important. We communicate with our county partners when we are doing a big event or a big push for CalFresh applications. This is in case they need more, they need to move staff around. We also provide cross trainings with our county partners. Our local county has previously given us CalFresh trainings in the past. We also have meetings with our county partners, and we communicate with our county liaisons on a regular basis. And the communication is usually funneled, so we have one person from our agency communicating with the county. This is so we can eliminate any confusion. And we also communicate with the county on a client's behalf, depending on the situation or the client's needs or questions. If the client is here in person with us, we call the county together, and then we'll follow up that way. All right, next slide, please. Next slide, please. All right, so our last piece here is the follow-ups. So our outreach workers are really familiar with the basic eligibility information and with the 30-day application process. And we follow up within 2 weeks of submitting an application. Usually by this time, the applicant should have heard back from the county, either received an appointment letter or completed an interview. So our follow-up conversations are guided by the applicant's response. So have they heard from the county? Have they had their interview? If they haven't heard from the county, did they recently have a change in address or phone number? Have they checked their mail recently? Do they know what verifications are needed? We also take this time to check on the applicant and ask if there are other needs. We usually have to follow up a couple of times. For example, if the applicant, or if we call the client and the interview was completed, we follow up to make sure that verifications were turned in. And then we follow up one last time to see if CalFresh benefits were granted. And older adults prefer phone calls. We have found that, with texting, that might be challenging depending on who it is. Emails, if they don't have internet or an email address, that's difficult. And phone calls in the mornings have been preferred by most of our older adults that we have assisted. All right, so next slide. And that's our contact information. If you have any questions, feel free to reach out to us. All right, next slide. And I'm turning it over to Phyllis at the Watts Labor Community Action Committee.
Thank you, Malai. As she said, my name is Phyllis Willis, and I'm the Senior Director for WLCAC's Aging Programs. And that includes over 22 zip codes. We have about 22 congregate meal sites. Also, we have senior housing for older adults, evidence-based programs, transportation, in-home services, and several other programs related to older adults. The history of WLCAC is that we are a nonprofit 5013C. We were incorporated in 1965. Our mission is to improve the quality of life for the residents of Watts and neighboring communities. WLCAC was established by Ted Watkins, who was part of the United Automobile Workers Union, shortly after the Watts riot. And there began our push towards addressing food insecurity through TED. Now, some 50 years later, our nutrition program delivers currently 211,000 meals annually, and beginning July 1st, that will double to about 400,000 meals. Half of those are be for homebound seniors who are unable to go out into the community. So food insecurity is our number one priority, and CalFresh, I'm very excited about this opportunity because we've had seniors come to all of our senior centers. We have 5 senior centers, and they want to sign up for CalFresh, and usually we only get about 3% that are eligible. So we're going to go back to all of those folks and get them to come back in. So this is a very exciting time for us. We also provide about, next slide, please. We provide about 18,000 one-way trips for older adults and those with disabilities. We will also be providing them with information about this new opportunity with CalFresh to become food secure. Our case management and supportive services, again, cover about 45 zip codes. Currently, it's about 22, and beginning July 1st, it'll be 45. As I said earlier, we have evidence-based programs, diabetes, hypertension, the UCLA memory, the Stanford models that we provide in senior housing and at our congregate meal sites and within our senior centers. We also have an economic development arm where we have about 150 commercial and residential properties. Next slide. Thank you. This is one of our best practices. We have this brochure that was developed by our benefits enrollment lead, who's here today with me, Karina Hernandez, and one of our managers, Olivia Drake. And we have this brochure in Spanish and English. And this, we always take an opportunity to market National Council on Aging, the Department of Aging. Laura Trejo is a great partner. Our councilman, Current Price, he's a great partner. And both of those folks are champions for benefits enrollment, and they're very excited about the CalFresh food policy change. So we use this on their websites, their platforms, to inform seniors where our sites are at, and it's become a very, very useful tool. Next slide. Okay, so these are our benefit enrollment centers, and I won't spend a lot of time on that. Our flagship senior center is the Bradley Senior Center, and Teresa Lindsay, and we also have Estelle Van Meter, and we have 2 others in our western area. Next slide. CalFresh, you'll see a lot of pictures here today that actually have a lot of food around them because, as I said, food insecurity is our number one goal. Ted Watkins back in 1965 actually started farming, and now we have another farm that we're building for the community of Watts. Watts has about 2.12 miles. About 40,000 folks live in that 2.12 miles. So we're dealing with food insecurity there. So we're going to also be able to do outreach in that area. So our best practices is making sure that we're culturally competent. We have bilingual staff. We hire seniors from the community and volunteers. We do a recognition program to keep them intact. Next slide. So Grantee, continuing our outreach best practices, we have what we call a client tracking sheet. So that tracking sheet, we do it through Google, and we actually send it out to all of our case managers. We send it out to our resident service coordinators at our properties. We're getting ready to implement that with our nutrition staff. We have about 35 nutrition staff so that they can begin to take the literature for CalFresh to their particular clients. They each have about 80 clients. We have about 8 drivers. So we're initiating that new process with them for our homebound seniors. I talked about marketing on our social media platforms. Our council office, he's our biggest champion. Laura Trejo at the Department of Aging is one of our great champions. And we integrate everything into our food programs, which we have food banks every Friday. We have food insecurity in the evenings with our seniors. We did an analysis with California Community Foundation that showed that all of our seniors were, 70% of our seniors were at high food risk. So from that, this program is very important to bridging that gap. Next slide, please. We also take a look at our outreach materials. We have a banner that you'll see on another slide. It stands about 7 feet tall. We have all of our information in English and Spanish. We make sure that we, as my colleague said, use other language and make sure that it's respectful. We build trust. I think that's our number one benefit, is that our clients in the community trust us because we're culturally relevant. We build upon the partnerships that we have. You know, what can we do for you? What can you do for us? Our property management company, we help them with weatherization, doing recertifications. They give us all their clients for handiwork, or they have a waiting list of about 400 clients, older adults. We also work very closely presenting this to the Department of Aging and the other senior programs. And success stories are our number one. Always a great success story brings in many new clients. Next slide, please. And this is one of the success stories, the Aguilaras who came into the center. Husband has Parkinson's. They put in many applications. The applications got returned. And when the applications got returned, our BEC counselor and lead, Karina, worked with them. And from there, they were very excited. They told this story to everyone. So now they weren't eligible for CalFresh, and now we're going to call them and tell them that they are. And they have been spreading the word. So we have them to kind of recruit within their community to bring folks into our center to get signed up for CalFresh. So we just give them a very brief marketing short speech to tell everyone. The next slide, please. And so I won't go through all of these, but the key network that really helps us a lot is our case managers. So every case manager, no matter if it's city or county, are part of have our tracking form. And they're sent back to Karina by the end of the month to be prepared for the 5th of the month. And then we also use our food banks to have tables to sign folks up that are disabled or elderly adults, our weatherization program, which I already mentioned, and our congregate sites, and of course our senior centers. On the external side, these are mostly events that we go through each year, or we hold the event at one of our senior centers at least once a quarter, and that helps us to get folks in. Next slide, please. Okay, so our cross-training is one of our greatest best practices. Everyone is trained, from the transportation staff, our door-to-door drivers. The seniors know them. They've worked here for 10 or 15 years. So they are part of the outreach for us. When those seniors get on their van, they hand out information. If they say they need food, they let the case manager know. And, of course, our congregate meal sites, and I think I spoke about the rest of these. And I actually let our executive staff, our administrative staff know what we have on our main campus at WLCAC. We hold a big market every 2 weeks. And at that market, we will set up a table to sign up those individuals that are coming to get food at that market. Next slide, please. And we target those with disabilities. They come in for our arthritis programs. We do the evidence-based programs through the Arthritis Foundation. So that's a great opportunity. So we're always looking for opportunities. Where are the opportunities? And everybody that's kind of the theme within our organization. Next slide. Next slide, please. Sustainability challenges. So increasing we have a large homeless, sustainability. Okay, broadening our volunteer training program. And we'll be working with our partners at CalFresh and ZPSS. I'm working on putting together a community action committee involving the Department of Aging, our council office, to talk about the actions we need to take within the wider community and how can they support that effort. Councilman Price has about 250,000 constituents. We're always able to use his platform. He's put us in the newspaper. National Council of Aging has been in the newspaper about all of these programs in CalFresh and on the social platform because of Councilman's efforts. So we definitely will include him when we get ready to talk about funding. We are getting ready to launch a food expansion program, which the food bank will allow us to take food to our homebound seniors. So this is another opportunity that we will find and build upon. And then we're looking for collaborative partners. When we have partners that live in different areas or different cities, we're not competing for anything. We can come together and ask for a much larger contract or grant that addresses either volunteering or it addresses getting more case managers or BEC counselors. So we're going to work on formulating and implementing and designing a plan for that. Next slide. Our challenges are our homeless population. We feed them quite frequently. We have a lot of older and elderly adults that come into our senior centers. So we're working on how to address food insecurity with this population and with CalFresh. And our case managers will definitely be integrated into that system. And we need funding, of course, to increase our capacity. We're growing, which is a blessing to reach all of the sites that we have. We haven't touched many of our properties. You know, we have over 150 properties. How do we touch those properties with the disabled that live there? So we're working on how can we develop an integrated city and county-wide system around food insecurity and include CalFresh in that implementation. And then we want to be innovative as we begin to design the system. You know, do something that someone has never done before. And so we're thinking and we're putting together ideas. We're working with several partners like UCLA, Dr. Catherine Sarkeesian, helping us to evaluate, you know, where are the gaps. We met with Genevieve last year. We discussed, you know, how we will look at data, but what's the most important data? And we felt that why don't people who don't come back or they don't access the services for CalFresh, what is the reason? It could be they just forgot, or it could be they don't have transportation. So I think that's what we're going to focus our analysis on, and I'll be working with Dr. Sarkeesian and the UCLA LA CAPRA team to look at our spreadsheet data and then begin to design another document to inform us of those findings. Next slide. Next slide, please. Hello, next slide, please. Thank you. So, and some of the solutions, of course, I mentioned already, is collaborating with CalFresh and some of our other partners and their team and their administrators. And we'll be working to measure and evaluate CalFresh outcomes with Dr. Sarkeesian at the UCLA LA Research CAPRA team. And we're going to be looking at volunteer organizations that are well known to see how we can work with them to recruit some of their retirees that are very high functioning and are looking for something meaningful to do. Next slide, please. And this is our banner I spoke about. It stands about 7 feet tall. We have this at all 3 of our centers. It costs about $140, but it's one of those outreach tools that you don't have to say anything. The wording is big enough, and they will come and ask for a case manager. So this has been a very successful tool. Next slide, please. And this is our tracking form that we'll be working with Dr. Sarkeesian to come pull some data to do our analysis. And this is a reporting form for our property managers, for our resident service coordinators, our case managers. Next slide, please. And this is Karina. She is the lead. She's doing a wonderful job. If you have any questions or you need to reach me, just contact Karina, and she will be more than happy to share with you any of the information that we've discussed in this presentation. Thank you.
Thank you, Phyllis, and thank you also to Erin, Myra, and Malai. I really, really appreciate the unique perspectives that each of you brought to this discussion. And I hope that each of our listeners found some useful information to help shape their interactions with people with disabilities. I also wanted to highlight a few more resources that are available on our CalFresh SSI webpage. Our CalFresh policy team has put together a policy refresher series, which is available online at our CalFresh SSI website, and 2 in particular may be of interest to you. One covers CalFresh eligibility rules for seniors and or people with disabilities, which is important because there are some meaningful differences for these groups of people with CalFresh eligibility. And the other provides some additional information on the Elderly Simplified Application Project, or ESAP. This series covers the series of waivers that California operates under to make the CalFresh client experience better for seniors and people with disabilities. And here are a few final reminders. There are 2 more webinars coming up in our Access for All series on April 16th, and I hope you join us for those. I've mentioned our website at cdss.ca.gov/CalFresh SSI several times. This is your one-stop shop for everything related to this program expansion. And if you have any questions, You may also email us at calfreshssi@dss.ca.gov. That's all for today. Thank you so much. Thank you again to all of our speakers, and have a great day.